Good morning, Jamal. My name is Karen, and I'm going to be talking with you today about your newly diagnosed condition, diabetes type 2. And I want you to know that this is just an informal discussion between the two of us, and if you want to ask me questions or interrupt me at any time, I want you to feel perfectly fine for doing that, because I just want you to have this conversation with me in order to learn about your condition and how to manage it, okay?
Yes, ma'am.
Do you have any questions before we get started?
Why did I get diabetes?
That's a great question, and really there may not be a great answer. Let me tell you a little bit about diabetes and how it works. There's two types of diabetes, type 1 and type 2. Type 1 is a little bit more complex than yours, and it happens really early in life. And type 2 happens later in life, like yours. And there's some things that predispose you, such as, you're an African American, you're over the age of 45, and some of your family members have diabetes. So that kind of predisposes you to having diabetes type 2. And also, there's nothing you can really do about that, but you're also overweight and inactive, you told me a little bit ago, and those are a couple of things that you can do something about. And today we're going to go over some of those things and kind of give you an overall picture of what diabetes is and how to manage it. Okay, sound good?
Yes, ma'am.
All right, so I will tell you that 3 million people in America have diabetes, and of those 3 million people, 90 to 95% of them, guess why they have diabetes type 2?
Overweight?
One, you're very, very good. They're either overweight and inactive. So those are two things that you can do a lot about, and so I'm excited to share some of those things with you today. What happens in your blood when the insulin, you have a pancreas here that's behind your stomach, and in diabetes type 2, it either doesn't produce enough insulin or it produces enough insulin, but it doesn't get into your cells effectively, so your cells have resistance to it. And your cells need to be able to have the insulin to convert to energy, so it kind of causes problems when that doesn't happen properly. So the extra blood sugar just kind of swirls around in your blood, and you have high blood sugar or diabetes type 2. Now when you have this high blood sugar in your blood, it can cause a lot of other pretty serious problems, like it can cause you to have heart disease or stroke or high blood pressure, and it really puts a lot of damage on your kidneys, your blood vessels, your heart, your eyes, and most of your organs. So it's really important to keep your blood sugar under control.
How long will I have diabetes?
That's a great question too, and sometimes when people ask me that, there's really no great answer, but sometimes I kind of explain it like this. Let's just say that this is you in your car and you decide to take a long journey, a long trip way up to another country, to Canada, okay? And so along this route or this plan, you're going to have a lot of references to try to keep you on this path so that you are able to meet your goal destination, okay? And along the way, you're going to have to cross the border, you're going to have roadblocks, you're going to have detours, but all in all, you're going to be able to start here with your diabetes or your trip and travel on the plan to reach your goal. As long as you kind of stick to the main plan and reach your goal, then your condition's going to be fairly easy to manage, and you may even be able to get off medications and your blood pressure may go back to normal. That has happened in some cases. So although I don't know exactly how long you'll have it, I do know that if you'll stay on the plan and manage it like we tell you, or as close to it as possible, then you should have very good success. Now, how do we stay on this plan? Well, there's several things that you can do. The first thing is you can have healthy eating. And I've set up an appointment for you with our dietitian, and she's going to go over how many calories and carbohydrates you should have on your particular diet in order to reach your goal. Now she's going to take I know you told me earlier that you like fried chicken, And she's going to take all of those food considerations into your plan, and she's going to help you come up with a diet that you can enjoy. Okay, so don't be afraid that, in fact, I don't even like to use the word diet. It's really more of a lifestyle change. Okay, it's not something temporary. You're going to be on this way of eating probably for the rest of your life, so you need to wrap your arms around it and understand it.
Yes, ma'am.
Other than the healthy eating, another thing you can do is have enough exercise. And I've also scheduled you an appointment with our exercise physiologist. And that physiologist is going to have you do at least 30 minutes of aerobic exercise every day, most days, at least 5 days a week. And the physiologist will look at your schedule, what kind of activities you like to do, and they'll come up with a good plan so that it'll be easier for you to stick to the plan. Other than healthy eating and the exercise, the next thing we're going to do is monitor our blood sugar. Our blood sugar should stay somewhere between 70 and 100. That's the normal range. And we want to try to keep it there, both with our healthy diet and our exercise, and also we're going to monitor this and have some medication to help us. So what we're going to do is take a tiny little drop of blood, and we're going to put it in a tiny machine, and within a few seconds it's going to give us a number, and that's our blood sugar number. If it happens to be above the 100, then we're going to have a little sliding scale that's going to tell us whatever our number is, we need to give ourselves this much insulin. And I've also scheduled you with our insulin specialist, who's going to go over all of the monitoring of your blood sugar and the insulin injections so that you'll not have any problem with it. And a lot of people say they're scared of needles. You don't need to be afraid. The needle's just a little bitty needle with a tiny little bit of insulin, and you just inject it into a little body fat, and a few seconds later it's all over. So there's nothing to worry about there.
Well, I don't like shots very much, so what happens if my blood sugar gets too low?
Excellent question. That's so important, because although our high blood sugar is bad, so is a low blood sugar. When your body's blood sugar drops below 70, then your body's probably going to react differently. You may have sweating, you may have tremors, you may get confused or be dizzy or have sweats or feel hungry, but your body's going to tell you that your blood sugar's low. So if this happens and you can check your blood sugar, go ahead and see what it is. But if you're somewhere where you can't do that, assume your blood sugar's low and go ahead and take 15 to 20 simple carbohydrates. And that might be like a cup of milk, half a cup of orange juice, a glucose tablet that's in your emergency kit, or maybe just some candy, something to bring your blood sugar back up to this normal. Now, you don't want to be going to get a giant blizzard, because if you do that, it's going to take it to the opposite end of the spectrum over here. We just want to bring it up to this normal range of 70 to 100. Did that answer your question?
Yes, ma'am.
Okay, good. So just to summarize, the things that you can do to help stay on your plan is healthy eating, losing some weight, staying active, taking your medications as prescribed, keeping all your follow-up appointments. You also want to have really good foot care, because sometimes diabetics can have poor circulation. They'll get a little sore on their foot and it's really hard to heal. So you'll want to wear shoes, make sure you have really good hygiene, and take good care of your feet, and just stick to your plan.
That sounds like a big lifestyle change, and for the rest of my life, what would happen if I don't do anything at all?
Well, unfortunately, if you don't manage your plan and try to stay as close to this plan as possible, it's going to be pretty bad. Let's say that you decide to not do anything, and you've ventured all down here way off your goal, and you're down here in Pakistan, and you know it's very dangerous there and life-threatening. You can get a heart attack, you can get a stroke, all kinds of bad things can happen, even death. So it's very, very, very important for you to stay on this plan. I would also encourage you to have the emergency diabetic kit that we're going to give you today. Carry some identification, and also let all of your friends and family know about your condition so that they're all on board and they know some of the signs and symptoms and a way to help you stay on the plan. Jamal, thank you so much for your time today. It was my pleasure to talk with you, and I wish you the best of luck. I want you to take these referrals with you that we went over earlier today, and just know that all of us are on your team. We all want to help you achieve your goals, and I wish you the best of luck. Thank you.
Thank you.